Good morning, class. My name is Julia Corio, and I will be presenting on magnesium sulfate as a drug. Magnesium sulfate is a medication used to manage and treat multiple clinical conditions. Mechanism of action of magnesium sulfate. In order to understand the mechanism action of magnesium sulfate, we first have to understand how magnesium itself works in the body. Magnesium is the second most plentiful cation of the intracellular fluids. It is essential for the activity of many enzyme systems. It also plays an important role with regard to neurochemical transmission and muscular excitability. In case of hypermagnesiemia, neuromuscular blockage or vasodilation occurs, and this leads to slow muscle contractions. In case of hypomagnesemia, competitive inhibition at the neuromuscular junction occurs, and this results in neuromuscular irritability due to increased acetylcholine release. So generally, magnesium sulfate reduces striated muscle contractions and blocks peripheral neuromuscular transmission by reducing acetylcholine release at the myoneural junction. It also inhibits calcium ion influx through the dihydropyridine sensitive voltage dependent channels. This accounts for much of its relaxant action on vascular smooth muscle. Pharmacologically, magnesium sulfate is a drug used to treat convulsions during pregnancy as an anticonvulsant. Nephritis in children. Nephritis is inflammation of the kidneys, and it is also used to treat magnesium deficiency and tetanus. Once magnesium sulfate is beyond the extracellular fluid, it enters bones and cells. It is then actively excreted into the urine. Magnesium sulfate administration can be oral, intramuscular, intraosseous, intravenous. Orally, magnesium sulfate is administered as a capsule or as a granule. Intramuscularly, magnesium sulfate is administered as an injection. Intraosseously is usually done when no other option is available, but in this case, magnesium sulfate is infused into the medullary cavity of the bone using a needle. Intravenously, it is administered as in solution. Magnesium sulfate can be combined with dextrose 5% or water to make the intravenous solution. Magnesium sulfate should not be administered if any known hypersensitivity reaction to magnesium sulfate has occurred in the past, or if a patient is in a known heart block, as it can worsen the already slowed cardiac conduction. Magnesium sulfate solution can be used as a contrast medium in cardiac and kidney computed tomography scanning. Iodine solution is the most common contrast medium for computed tomography examinations. However, iodine compounds can induce allergy or kidney failure. Hence, magnesium sulfate nanoparticle solution can be used as an alternative contrast agent. Magnesium sulfate can also be used as a contrast medium in magnetic resonance imaging of the small intestine. 2.5% magnesium sulfate is the ideal concentration for small bowel MRI. It can decrease the absorption of water and fully fill the enteric cavity, and this increases the contrast between the intestinal wall and the lumen, and facilitating radiographic examination of the small bowel. MRI with 2.5% magnesium sulfate can demonstrate intestinal abnormalities more than other contrast medium. Thank you.